Well, a shocking revelation by Congress is calling Americans' right to health privacy into question, and if your medical data can be used criminally against you. In a letter to the Department of Health and Human Services, lawmakers shared their concerns over how the nation's largest pharmacy chains handle requests for records from law enforcement and don't require a warrant. As of now, only one of the chains, Amazon Pharmacy, actually alert the customer if their records were requested, meaning a majority of the 60,000 or so pharmacies across the nation have no policy that protects or alerts the customer. Now, this revelation is particularly alarming for women, especially those living in states seeking to criminalize abortion and drugs related to reproductive health. The pharmacies can access a person's records from any location, which can then link a person's out-of-state medical records, including pregnancy termination, back to their home state. Harry Nelson is a healthcare attorney and expert at healthcare public policy. He joins us now live. Harry, great to have you for this conversation. Thank you.
Thanks for having me on.
Well, we'll get into some of those criminal consequences in just a moment. But first, for the average customer, the burden is on Americans to request their medical record disclosure data from healthcare providers. But few people do. Many aren't versed on those terms. And some of the country's biggest chains tell their staff to respond to law enforcement immediately. Now, CVS has suggested a warrant or judge-issued subpoena requirement for pharmacies to turn data over to law enforcement. Do you think that would be sufficient? And if not, what do you see as the best solution here?
Yeah, this is a real problem. It's been going on for years. Essentially, pharmacies have been responding and even volunteering information in many cases to law enforcement, to medical boards, for example, to when anytime that there's any concern, either coming from a law enforcement agency, a medical board, or from the pharmacy or the pharmacist itself, and really have not been responding at all, not been waiting for appropriate process that would notify consumers. So I think that a requirement that records not be disclosed without notice, that records be required to be subpoenaed or have some other a search warrant or a subpoena would be a valuable protection, and it would really fill a hole that most people have been ignoring until now.
Well, I hear that argument. And another big issue we didn't delve deeply into is mental health. This plays into, as you know, a slew of criminal cases in a variety of ways. Are there instances where you believe exceptions should be made for the greater good of society?
Yeah, look, I think the challenge is that there are certainly cases where there's really extreme kinds of unusual patterns going on. For example, where patients may be going to multiple doctors to get medications in a way that anyone would regard as abusive. That's not really where the problem is. Where I hope that this congressional inquiry will go is to this question of pharmacists and pharmacies just second guessing doctors and the relationship between doctors and patients. And what we're finding is that it's happening in a disturbing number of cases across the country. And these big pharmacies have really been complicit in just volunteering information that really isn't appropriate for medical boards to look at, that really do invade the privacy of doctors and patients.
And I think that's what's been so shocking about this report. Another major concern that we touched on is that records are often shared across different states. So for women living in states seeking to criminalize abortion and drugs related to reproductive health, their records could follow them home. That could create a slew of other issues. How do you see those specific situations playing out?
Well, it's a legitimate concern. Until recently, women who were seeking a medication for abortion had to go to their physician to dispense it. The FDA only allowed for abortion-related medications to be dispensed from pharmacies in the last few months. But now that has happened, it's absolutely a legitimate concern because nobody expects CVS, for example, or any of the national pharmacies to separate out their records from, let's say, California. For a person traveling to, let's say, Texas. CVS, Walgreens, all these large pharmacies are operating in all these states. And so all of a sudden you have a case where women living in or traveling through states that are that criminalize abortion medications, all of a sudden are at risk by virtue of the way that these large national pharmacies keep records. So this is absolutely a legitimate concern, and anybody who cares about reproductive health privacy should take this very seriously.
All right, Harry Nelson, we appreciate you weighing in. Thank you.
Thanks so much.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.